Hello, my name is Alan David. I'm one of the partners at Dental Laboratory Associates. We're going to go through a short clip of when patients come and see me for shade analysis. A lot of the time, dentists will send the patients to me when we're making a crown bridge implant case, and patients are a little concerned about what the shade is going to look like. So I like to see the patients myself. I take some photographs. I ask the patients a few questions on what their expectations are, and we'll go through a short exercise with Des over here, and I'll show you what I do and how easy and simple, quick and painless the whole exercise is with the patient. Done. A lot of the time the patients are concerned if it's going to match. A lot of the time the patients are concerned that if they're going to do some whitening at a later date, is the crown going to be affected by the whitening, or is the crown going to change? If the patient is definitely going to have some whitening done, and they've spoken to the dentist about this process, then I'd like the whitening to be done before I take a shade. So we'll get the whitening out of the way. Sometimes it's a 2-week process of the whitening. Sometimes there is a process that can be done in the dentist's office, a 4-hour quick and simple method of whitening. But usually it's a 2-week period where the whitening is done, and then I like to take the shade a week or so after that so that the whitening is settled down. And then we can do the color analysis, the color match, and it'll be much more accurate. So once that's out of the way, if you're not going to do any whitening, I know your teeth are quite light anyway, you're not going to do any whitening if you were to have a crown done. So I will do a quick look at your teeth. I'll get to see what the shade is more or less. I don't have to be accurate with my shade because I'm going to punch it into the computer. I have a program that I use that gives me really accurate shade analysis. I have my camera already set up. A lot of the time I'll put a little sign at the bottom over here, patient's name, dentist's name, and the shade that I'm using, just so that I have it on record as well. So the whole process is really quick and simple. I'll get the patient, a lot of the time I'll get the patient to be interactive with me. I'll say, Des has got a nice smile line. So I'll say to the patient, just lift your lip up with your 2 index fingers, one on each side. Kind of gets the patient, and open, don't bite together. Open it just a little bit more. And that's all I need. You can see the picture I've taken. I have a white balance and a black balance, and I have the 2 shade tabs, which are over there. Focal length is already preset. I've got a picture of Des's teeth, and that's all I need. I put that in the computer and everything will be done for me. Quick and simple. Our ultimate aim is that the patient is comfortable. The patient asks whatever questions they want to, and I'll answer them the best I can. The patient is in and out within 5 minutes. I take the shade, the patient's comfortable and relaxed, and we'll even offer them a cup of coffee after we've taken the shade, because we don't want the color affected by the card.